So the programme would have originated about 2 years ago, or at least the idea for the programme, and it became clear to everyone sitting on the Women's National League Committee at the time that we could relatively simply and easily put supports in place, not just for players but also the coaches and club administrators. The actual curriculum or the materials that have emerged are based on a survey that we did about 12 months ago. So we asked players themselves, people involved in clubs, volunteers, and also the coaches, what were the sort of things that they understood around this area, what was their biggest challenges, and the overwhelming feedback is there's so much information out there that they needed to kind of know the number to ring, the resource, who I can talk to, specifics. And then building on from that, every single club will be linked in with their local resource officer. That resource officer can link them directly into local resources that are relevant for their area, but then they can tailor needs and the programme to what that club needs at that particular time. And I suppose thirdly, they're a point of contact if they need further help or guidance as well.
Obviously, it's another step in a huge step in the right direction for women's football, having a wellbeing programme brought into the league. I think it's coming at a great time, obviously coming out of COVID. A lot of people are struggling with their mental health, and I spoke openly about when I struggled with my mental health, and back then it wasn't really spoken about as much as it is now. Even staff members from DLR, when I kind of struggled, helped me a lot. I think that's the programme's coming in at a good time to kind of get people to come forward and speak, and there's going to be someone in each club kind of there for you to go to if you are struggling, and I think it's coming in at a great time, yeah.
Coming out of COVID now, we're seeing a lot of people are seeking help, and I think this is an opportunity for us to give clubs, I suppose, a starting point as to what they can do. For clubs, it's going to be different. The needs of a club in Dublin is going to be different to ourselves or a club in Galway. So I think it's just to give them a starting point to know where they can, who to go to and who to reach out to. And working with Martin Ryan and the HSE has given us the opportunity to build those links between the clubs and the HSE, and I think that's kind of one of the main things about it. I think it's really important that the Women's National League can lead on this, and that the Men's League and the younger leagues can look at it and say, well, this is what they're doing. Maybe we'll ask them and see how they did it. How did they go about doing it? But it's important, I think, for the Women's National League to be leading in something as well.
Overall, it was a unique opportunity for the two groups, the National Office of Suicide Prevention and the Women's League, to work together. If we know what mental health is, and if we know how we feel when our mental health is good, then we can learn to look after it as well, and that's where the clubs come in and the players come in. Their mental health is as important as their physical health. They are going to be at their top performance if they're mentally well as physically well. So it should be just the same as a player saying, okay, I can't play today because I twisted my ankle. Really, I don't want to play today, I feel off. We need to be aware of what we are like when we're well, to be able to recognise when things are slipping, so we can intervene before there's a crisis.